Hi, my name's Ross Hauser. I'm a medical doctor that specializes in prolotherapy. I'm actually a board certified physical medicine and rehabilitation specialist. For 23 years, I've been doing prolotherapy for the treatment of joint instability. A lot of people may not know what joint instability is, but it's basically a condition, it's a medical condition where adjacent bones, so imagine this is a bone and this is the bone next to it, that the bones are moving too much. Like they're moving too much, and that can cause like the joint, the cartilage, to break down. So joint instability occurs because the ligaments that connect the bones are too stretched out. I'm here with Hillary, who has a genetic condition called Ehlers-Danlos syndrome, and I'm specifically making this video to try to educate people on prolotherapy with the hopes that they will help her with some of her medical costs related to prolotherapy and the treatment of your Ehlers-Danlos syndrome. Now, you're only 1 day removed from your treatment from yesterday, which to go over the treatment, what we did was we took out bone marrow, and then we used that your own bone marrow, your own stem cells, as the proliferant in many different parts of your body. And your Ehlers-Danlos, it's causing your bones not just to move too much, but actually some of them actually dislocate to the point where your fingers, you need basically braces on them, your wrists. You know, you just took off your, and the only reason you're able to take off your collar was because you got prolotherapy in your neck yesterday, and now it's still kind of swollen from the.
It's definitely a lot stiffer today, which is what I was hoping for.
Yeah, exactly. And then you see the knee braces, so you can't walk without a knee brace. Now, as it relates to prolotherapy for Ehlers-Danlos syndrome, you know that I wish we could get the ligaments really, really tight with just one visit, but it normally takes multiple visits. And because your condition is so extensive, you and I had talked about you're actually probably going to need 1 to 2 years of care. But the prognosis is very, very good if you can receive regular prolotherapy. So I think you're ultimately going to need most of the joints of your body, if not all the joints of your body. Because again, Ehlers-Danlos syndrome is a genetic disorder where the body doesn't make a really strong structural collagen, a collagen that's really, really strong, and collagen is what makes up the ligaments. But prolotherapy, and you know, I've had a lot of clients like that were teenagers, and then now one of our patients is a PhD, and they go on to college, and we have some of our Ehlers-Danlos patients now are in college, you know, and then one of our clients right now, she originally came to me again with braces on her ankles, and in college, she's a freshman, she took a ballroom dance. So that would only occur, right, if her ankles are not just stable enough to walk without braces, but do you know how much force is with ballroom dance? So prolotherapy can definitely stabilize the joints of Ehlers-Danlos, but it's when it's so many joints, it's just going to take longer than if somebody came with just one joint. So if anyone can help, if that's watching this, Hillary, the prognosis is very good if you get prolotherapy, and you're probably going to need prolotherapy for 1 to 2 for about 1 to 2 years because it's so many body parts. But getting you out of these the prognosis is excellent with proper treatment.
Sounds great.